Hey folks, Dr. Joe Esposito here. Glad you're with us today. We're talking about the one component that is present in almost every disease known to man, and that's chronic inflammation. Now, that might not sound too sexy right away, but trust me, we got a lot of good information going on here because inflammation is a component of everything. And as a chiropractor and an orthopedist, pain management doctor, nutritionist, I see inflammation in every single case I've ever seen in the past 38 years that I've been in practice. Now, inflammation can be the cause of the problem. Inflammation can be a side effect of the problem. Either way, we're going to teach you today how to manage chronic inflammation because it's things you're doing every day that is causing this inflammation to occur. And then what do we do about it? That's the most important thing, is not only diagnosing, but treating. Because I've had patients come in for countless years, or all my years I've been in practice. Dr. Joe, I was diagnosed with blank. You pick it. High blood pressure, diabetes, whatever it is. So what are you doing about it? I don't know. Taking some medication for it. Okay, you're getting to the cause of the problem? 100% of the time, the answer is, I don't know. I don't know what that means. Or no. So we're going to try to get to the cause, the root cause of almost every disease known to man, or certainly a component to it, and then what to do about it. So chronic inflammation diseases cause your body to overreact, and in some cases, they start to attack itself. So an autoimmune disease would be a chronic inflammation condition. Autoimmune is when the body attacks itself. Rheumatoid arthritis, lupus, where the immune system looks at the cells, the self it's called, looks at your healthy cells and goes, wait a minute, that doesn't look right. I better attack that. And it does. It attacks it, but it attacks it abnormally. Too much reaction. So that's an autoimmune disease. And also, if you're eating bad foods, your body is trying to attack this bad food, chemicals you're being exposed to, and that can cause inflammation as well. So it affects the nervous system, and it makes the signals in the nervous system harder to get through. Now, if you've listened to our shows before, you know I'm really big on the nervous system because it controls everything. Nothing in your body happens unless the nervous system tells it what to do. So right now, your brain is sending messages down the spine, out the nerves to every cell in the body. So there's a nerve that makes your heart beat, your lungs breathe, and your eyes see, and your colon digest food, and your pancreas work, and your toenails grow, and everything is hardwired to the brain by way of a nerve. And the nerve sends messages down from the brain, and nerves also send messages back up to the brain, giving the brain feedback. A good example is you touch something hot. That's hot. Pull my hand away. Don't touch that again. So we have afferent messages going away from the brain and efferent messages going to the brain constantly. Every year we seem to find out that it's happening faster and faster than we thought it was. So we have to have that flow of energy going back and forth unimpeded. And it can be blocked by physical, which would be a bone out of place, pinching a nerve, or chemical, which is things that cause inflammation, or chemicals can actually interact with the nerves. So we want to make sure the nervous system is working physically as well as chemically. This, I believe, is one of the missing points of healthcare, certainly modern healthcare in the United States. But our bodies have to have normal nerve function, and it's often ignored. Now, if I have a pinched nerve, I want to take some medication to cover up the pain. If I have surgery, I want to take medication to cover up the pain. But we always want to try to get those nerves working the best they possibly can. So from a chiropractic standpoint, that's what we do. We look for pinched nerves and unpinch them, and we're really good at that. My doctors are and I. And then chemically, we do something that I don't know if any other clinic does. We do a whole nutrition workup on our patients. We try to get to the cause chemically as well as physically. Chemically is causing a lot of the inflammation. And this is something you have total control over. You don't have control over the fact you got in a car accident, maybe, and you damage the nerves and there's inflammation, but you do have control over what you eat and the chemicals you expose your body to. So what might be some signs that you have this severe inflammatory reaction going on in your body? Well, one of them is pain. Of course, if you have neck pain, back pain, shoulder pain, headaches, numbness, tingling, absolutely positively, that's something you want to deal with. And chiropractic is the most effective, least expensive treatment for most back conditions. So if you have pain, especially back pain, but really any pain, why you're not going to the chiropractor first is beyond me. In fact, I was just talking to some lawyers the other day, and we were talking about auto accident cases. And a lot of times the attorneys will send you right off to surgery. So let's get you to a surgeon, let's chop you up, and let's get those big bills, hundreds of thousands of dollars worth of bills, because then hopefully they get a good settlement. We prove there was damage. Well, the insurance companies are getting smart. What the insurance companies are doing now is saying, well, why didn't you try something conservative first? Why did you jump right to this tens of thousands, $100,000 surgery? You should have a protocol. And so in our office, we do what's called escalation of care. And I came up with that term. I don't know if anybody else uses it. But what we do is we start out very conservative. Chiropractic care, nutrition, supplements. Let's see how you do. Most cases respond very well. If we need to, we can escalate to trigger point therapy, PRP injections, medications. Let's see if that works. If that doesn't work, then we can go higher up the ladder. I hate to say higher, maybe in a different direction. And we can do spinal injections, ablations. We can block the nerves. And then from there, we can always end up at surgery. And what the attorneys are finding is that it's much easier to get a settlement in auto accident cases because when they go before a jury or a deposition, the other insurance company is going to say, why didn't you try something conservative first? Why did you jump to this tens of thousands, $100,000 worth of treatment? And it really blows up their case because they don't have an answer. We don't know. And so the insurance company's getting smart, attacking these high bills. And so what we're doing is we try to escalate it so that if we ever do need the surgery, we've documented everything. And it's the best course of treatment for you in most cases. Sometimes you need surgery right away, but it's the best course of treatment for you. So that's what we try to do is we try to get to the cause of the problem. And one of the things we try to do is bring down the inflammation. So other signs you have this chronic inflammation. Of course, pain's a biggie. Whenever there's pain is inflammation. Insulin resistance. What's another word for that? Type 2 diabetes. Type 2 diabetes many times is due to an inflammatory reaction, and you're eating too much animal fats. Animal fats can block up the cells. So what happens is insulin is released by your pancreas, goes into a cell, opens up the cell, kind of like a key, opens up the cell and allows glucose in. We are finding if you're eating a high protein, animal protein diet with fat, the fat apparently is blocking up the receptor sites so the insulin can't get into the cell, and the cell can't open up to allow the sugar in, so the sugar stays in the blood. You have insulin resistance. You're resisting insulin from working. Why? The keyhole is blocked up. Put it to you simple. Now, if you have too high sugar, that can damage your nerves and your blood vessels. And of course, insulin resistance is early stages of diabetes. It's kind of another term for it, the beginning stages. You might have tingling feet. You might be thirsty. You might be tired. You might not have any symptoms. But insulin resistance is a biggie, and it can cause inflammation because the sugar isn't being processed. And sugar causes inflammation. Inflammation then affects the nervous system. The nervous system controls everything. So regardless of what condition you have, I want to make sure you have a normally functioning nervous system physically. That's where chiropractic comes in. And we want to make sure you have the best chemicals in the body to make the nervous system work the best it possibly can. It's not a hard protocol, folks. Nervous system, digestive system, and diet. Those are the three things we have to have in order to obtain and maintain good health. And so regardless of what the condition is, I would say let's add that to your protocol. Just makes sense. And it's the most effective, least expensive for most back pain too. So no reason why you wouldn't do it. If you have muscle weakness all the time, this can be a sign you have too much inflammation. The immune system sometimes can attack the muscles. It's called myositis. We have a fancy word for it. Now, this can start to break down the muscle fibers, and that can make you weaker. It usually happens slowly, most often in kind of your torso, your shoulders, your hips, in that area. And in some cases, you might find it hard to do simple things like walking, bathing, swallowing, which is kind of important, so you swallow your food and your drink. So we want to get the inflammation down. So if you have bones out of place, that's something physical. That's not something you can do. You need to come see people like us who are very good at realigning everything and taking the pressure off the joints. That'll bring down some inflammation. And from a dietary standpoint, you have to decide what you're going to eat, what you're not going to eat. Now, in years past, I've talked about the 7 deadly sins of nutrition. And they are, if you're new to the show, alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Now, collectively, you all thought, Dr. Joe, that's all I eat is alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. And if I gave up alcohol, meat, sugar, dairy, coffee, and artificial sweetener, I would then starve to death because there's no other food in the world. Not true. I made hummus the other day. Tahini, which is sesame seed butter, kind of like peanut butter made with sesame seeds. Chickpeas, a little bit of lemon juice, a little bit of salt. I put some cumin in there because I had it. You can throw garlic in there if you want to. You can throw roasted peppers in if you want to. You can throw olives in if you want to. And for an entire meal, cost me about probably $1.50. And it took maybe 5 minutes to make. It took longer to wash out the food processor than it did to make it. That's how easy it is to make. So you can decide that I'm going to have a $1.50 meal of hummus, and then I had a gluten-free wrap with it. That might have been another 20 cents. Or I can decide I'm going to have a burger and fries, a shake, and some onion rings. Every one of those things is feeding inflammation. It's like throwing fuel onto the fire. And that inflammation can adversely affect the nervous system, which affects the organs. And it could put mechanical stress on the organs as well. And that's one of the reasons why you might have muscle weakness if you have a lot of inflammation in the body. If you have diarrhea, irritable bowel disease, there's two major forms, ulcerative colitis and Crohn's. And there's other types, but irritable bowel disease just means your colon is inflamed. In both cases, the immune system overacts and inflames the colon and small intestine, and diarrhea is one of the things that can happen. You might have nausea, joint pain, fever, rashes. If you have digestive problems, and how about this? If you don't have digestive problems, I recommend you try to avoid wheat and dairy products. Wheat and dairy are the two most inflammatory foods, the most hyperallergenic foods that you can eat. So my challenge is very simple. My challenge is cut out all wheat and all dairy for 2 weeks. At the end of 2 weeks, have some wheat and dairy. Have a piece of pizza. Have a couple of pieces of pizza. Have some cheesecake. See how you feel. It's a very simple test. It's absolutely free. If you feel good when you're not eating wheat and dairy, and you don't feel good when you are eating it, then you might want to consider that Dr. Joe was right. If you don't see any reaction, and I've never had anybody not have a reaction, a positive reaction, then you can say Dr. Joe was wrong, and I'm going to go back to eating the alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Don't go back to that, folks. I'm being facetious when I say this is a challenge. The challenge is that you'll see a difference, and you'll say, okay, now I get it. Whether you decide to stay with it, that's totally up to you. Trust me, it's worth it. I have patients coming to me, many end-of-life patients, have been for years. Dr. Joe, the only regret I have is I wish I'd taken better care of myself. I wish I'd listened to you sooner. I'm sorry that I've been listening to you for, 30 years. I've been lecturing now for about 40 years, that I didn't listen to you sooner. And now I regret that decision. Sometimes it's too late. Many times it's not, but sometimes it is. So just think about an anti-inflammatory lifestyle. It's going to always pay huge dividends, better than anything you can invest in. So if you have constant loose stools, it could be an inflammatory reaction. It could be a pinched nerve in the low back. The nerves in the low back control the bowels. So if patients come into us with digestive issues, we check the nerves going to the organs. We check the chemistry so that the nerves are flowing without any interruption from a chemical standpoint. That's called your diet. And then many times the stomach is pushed up against the diaphragm. And that might lead to difficulty breathing, acid reflux, heartburn, burping, gas, bloating, chronic cough. So in those cases, we need to pull the stomach down away from the diaphragm, physically adjust the stomach. There's a valve called the ileocecal valve. It's between your large and small intestine. And if the valve is stuck open, you have diarrhea. If it's stuck closed, you might have constipation. So we can actually adjust the ileocecal valve as well. So many times your health problems are not only chemical, they're physical. That's a big missing link. Very few people think about the physical component of healthcare. They only think about the chemical. What can I eat? What supplement can I take? What drug can I take? Every day, multiple times a day, people send messages through our website, drjoe.com, drjoe.com, and they say, Dr. Joe, what supplement can I take for blank? And I answer them, well, high blood pressure, you might benefit from nitric oxide. And if you're tired, you might try B12 and nitric oxide. If you just need general health care, of course, the minimum supplements everybody should be taking are Dr. Joe's Super Greens and Dr. Joe's Essential Source, almost everybody. Super Greens and Essential Source, immune system, vitamin D, glutathione. So there are supplements, but you also want to treat the cause. Change your diet, check the nervous system, fix the digestive system. Then the supplements are exponentially more effective in most cases because it's like putting good gas in the car, but also tuning it up. Putting good gas in it is important. Tuning it up is important. but you got to do both to get the best gas mileage. Well, if you want to get life mileage, that's the best way to get your life mileage. I just made that word up, life mileage. We're going to use that. If you have back pain, neck pain, shoulder pain, we talked about that many times. That's an inflammatory reaction. Well, the pinched nerve causes inflammation. The inflammation then has a cascading effect on other aspects of your life. So this is why I can't fathom. I can fathom a lot of things in my life. I can't fathom why people aren't getting their spines checked to see if they have pinched nerves. I don't know why you wouldn't do it. I mean, it's so vital. It's probably the most important thing you can do for your health. And we do that in our offices. We have offices in Marietta, Duluth, Stockbridge, and West Cobb, the Atlanta area. I know this show goes all over the world. If you'd like to make an appointment, we would love the opportunity to be your doctors. So if you have a health issue, neck pain, back pain, shoulder pain, headaches, if you've ever been in a car accident, please, I'm begging you, get to see us immediately. Don't get scammed. Don't go to the wrong clinic. Come see us. Probably you're going to be happy with the results. drjoe.com. You can book an appointment right online. Normally, the first visit is $720. We've reduced that to $299. That's a 58% savings. That's an exam, x-rays, consultation, first adjustment, the next visit going over your x-rays, and a complete nutrition evaluation. Nutrition evaluation alone is $150. So there's no reason why you shouldn't be making an appointment right now. We accept almost every insurance out there as well. Almost, not all. And even the VA. The VA, we're one of the clinics that the VA sends a lot of patients to. And if you're under VA care and they send you here, they pay for your treatment. Oh my gosh. How can I make this any easier for you? I can't. drjoe.com. Book an appointment right now. Don't waste time. Don't wait next week. The holiday, whatever. No, just do it now. drjoe.com. And we would love the opportunity to see you. And bring your kids too, because if kids are healthy starting out, they have a much better chance of having a healthy life. Other things that may tell you that you have chronic inflammation and you need to fix the nervous system, digestive system, and your diet. You're always tired. How many people are tired all the time? Raise your hands. I have one of my co-hosts on the radio station, and she has come to me and she said, I give you a challenge, Dr. Joe. You got to get me off my coffee. She says, I love your show. I listen to it all the time. You got to get me off my coffee. So we talked about everything we're talking about today. We're going to get her on Dr. Joe's Super Greens, Dr. Joe's Essential Source, Dr. Joe's Nitric Oxide, which opens up blood vessels, B-complex, and adrenal support. If you were to buy all those supplements, it's still cheaper than drinking a fancy cup of coffee. And you're getting health benefits from it as opposed to a fancy cup of coffee, which has negative effects on your body. Why wouldn't you do it? Oh my gosh. It's less expensive, more effective, and not dangerous? Yeah. Holy cow, that sounds like a good deal. It is a good deal. My goal is to get you well and keep you well. That's what we want to do. So if you're tired all the time, try changing your diet. I think you'll be amazed how quickly it changes. If you just did nothing but drank more water, you'd probably be thrilled with how much more energy you have. And then you take away the bad foods, add the good foods, add some supplementation. People ask me all the time, Dr. Joe, at your age, how does your brain work? How do you do all the things that you do in a day? How do you have time for anything? I said, I'm no different than you. I just take care of myself. I don't have some genetic predisposition to a super genius brain. No, I just take care of myself. And you can do the same thing. It's not hard. It's really easy. And if you have questions, you can always go to our website, drjoe.com, and send us questions through the website. We're happy to answer them for you. So you're tired all the time. You have skin rashes. There's a purplish rash that can come up. It looks like marble, and it's web-like, and it looks like lace and webs. And that's an inflammatory condition like lupus, and it can cause that. And it usually you get this on your arms and your legs. You might notice it more when you start to get cold, physically cold. That's a sign that you have chronic inflammation. The blood vessels are inflamed. So what do we do about it? It's the same thing. Get on a good diet, get the nervous system and the joints lined up properly, take the swelling off the digestive system by physically fixing it and chemically fixing it, and let's see what happens. I can't promise you anything. I can't guarantee anything. But I can tell you after 38 years of seeing, I'm going to guess, tens of thousands of patients, plus my other doctors that see patients, we see so many patients in our offices, the results are pretty standard across the board. In most cases, people are very, very happy with their choice. And they regret that they didn't do it sooner. So drjoe.com, you can become one of our patients. If you have hardening of the arteries, arteriosclerosis, this is a sign that your body is in chronic inflammation. The way it works is if you irritate the blood vessels, let's say you irritate an artery. Well, imagine it's a little scratch in the artery. So now the body has to lay down a scab so that scratch doesn't get bigger and bigger and the artery bursts. Well, the body uses cholesterol as a putty. It fills in that hole. And so if you have hardening the arteries, that's all you're doing is your body's laying down putty, laying down spackle to try to protect the artery walls. But in the meantime, you're making the blood vessels smaller and smaller. And then the danger occurs that if one of that piece breaks off, piece of that putty, that plaque, and it goes into the brain or the heart, you can have a heart attack or a stroke, or in the lungs, a pulmonary embolus. So why would you do things that you know is going to cause the body to lay down putty and narrow the blood vessel walls? I don't know that answer. Because you cannot do it just as easily. You have to eat anyway. You might as well eat good food. You have to tune up your body eventually, whether you're dealing with surgery or drugs or physical therapy or chiropractic. Why not start with chiropractic and hopefully prevent those serious problems later on? In most cases, not everyone, but most cases. So we would love to see you as a patient. We have offices, again, in the Atlanta area, Marietta, Duluth, Stockbridge, and West Cobb. The website, drjoe.com. So we see arteriosclerosis all the time on x-rays. And we have to bring it up to the patient. And we say, okay, we're going to do a chiropractic protocol for you, which is only several weeks of care. It's not forever usually. I mean, we like to maintain you forever. But we also do a nutrition workup on every patient. I had an auto accident case come in, sent by us from I think it was sent by an attorney. And we did nutrition evaluation. And the patient said, well, this doesn't have anything to do with my car accident. I said, I know. But I want to get you well. Our goal isn't just run up the bills and give you a little, patchwork. We want to actually get you well from this accident. We want the accident in some bizarre way to be a good thing that you learned how to take care of yourself. They were so impressed. I've never had a doctor actually go way beyond just here's a pill, get out of here. We go way beyond in our practice. If you have blood clotting, that could be a sign that you have a lot of inflammation. And once again, with circulation, heart disease, the studies are clear. They cannot be clearer. Plant-based diet it can help stabilize, slightly reverse, and in some cases eliminate hardening the arteries and heart disease. Plant-based diet, what I've been teaching you for the past 40 years. And it's not hard to do. If you don't know what to eat, go to our website, drjoe.com, drjoe.com. Type in the words 7 Deadly Sins of Nutrition. Listen to that show we did. There we talk about the bad foods. Then type in, so what can I eat? And that tells you what to eat. Oh, by the way, on the website, over 2,000 hours of podcasts. Cost to be a member? Nothing. Just go on and listen. You don't have to sign up or anything. Just listen to the shows. I don't even ask you for your email address. They're all there. If you're a podcast junkie, like using your podcast service, type in Dr. Joe for the health of it. DRJOE for the health of it. And that'll bring you up our shows that we have on our podcast services. Again, the website, drjoe.com, we have all our supplements there. So you can order supplements online like Super Greens and Essential Source, minimum supplements you should be taking. Turmeric, we're going to cover that later. I don't have time. Turmeric is a wonderful anti-inflammatory. I take it every day, and we have the turmeric supplements on the website, drjoe.com. But if you have specific questions, you can look at the store. It has all the supplements and, the benefits. If you have questions beyond that, you can't find it. If you type in the search bar what you're looking for, you can't find it. Just send us a message. Joe, my assistant, or I will get back to you as quickly as possible. Again, most important thing, though, is make an appointment. drjoe.com. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. And we said earlier, car accidents, please, I'm begging you. I teach other doctors, lawyers, physical therapists how to deal with car accidents. So you can come to the source if you'd like, and hopefully we can get you treated as well. And, podcasts. Yeah, back to the podcast. Listen to any podcast you'd like. Feel free to use it any way you'd like. Download it. It's my gift to you. Almost out of time. If you have any questions, drjoe.com. Veterans, please come see us. VA will pay for your treatment. drjoe.com. We'll see you soon.